So what's new in gallbladder surgery today? Well, a few things. Gallbladder surgery has become more common, and it's more commonly performed on an outpatient basis. It is what's considered a minimally invasive procedure almost all the time. There are still a few cases in which an open surgical technique is required. For example, if there has been a lot of previous surgery in that area of the body, or if there's a very severe amount of inflammation. But other than those few cases, over 90% of the procedures can be performed with a minimally invasive technique. And today that means very small incisions and laparoscopy, or minimally invasive technology, to do the procedure. So that has led to a couple of new things. One is that the setting for conducting the gallbladder procedure has moved often to the outpatient arena. And that's the outpatient surgical center, or the so-called ambulatory surgical center. And it means that most people can come in and have the procedure done and then go home the very same day. And usually recovery times are also quicker than they once were, on the order of a week, sometimes 2 weeks. So those are new developments that I think are good improvements. We've also seen technology move to smaller instruments to be able to conduct the procedure. For example, the cameras that we use in laparoscopy are often now down to 5mm instruments. And if you think about it, a 5mm diameter instrument is really quite small. And so that allows us to make even smaller incisions. So in my hands, and in the hands of a lot of people who do these procedures, the gallbladder procedure will take about 30 minutes in many cases, sometimes even a little bit less, occasionally a little more. And it can be done on an outpatient basis where the person can go on home the very same day, recover within a few days, a week, sometimes a little longer if they have a very physical job. Something even more recent that is a development is the use of what's called single-site technology and use of the Da Vinci robotic system for removal of the gallbladder. This is a new development in which instead of using 4 small incisions, we can now do the whole procedure through 1 single small incision. So this is kind of an exciting development and leaves a little bit better cosmetic result in a few cases, and it just means a few less incisions. And with this technology, we can still conduct the procedure, use a single small incision. It can still be done as an outpatient or same-day surgery procedure or technique, and the recovery time can still be pretty short and small, and people bounce back with only that 1 scar. So those are a few things that have come along. I think the technology continues to evolve, and we continue to get a little bit better at doing this procedure as well as others in a less and less invasive fashion, meaning less downtime, less risks, and greater speed of returning back to work and regular life.